Are you considering penile implant surgery and wonder how much the entire surgery will cost? You wish to understand if the insurance company will cover and how does that work? Today I will talk about how insurances work in regards to this surgery and what to consider if you are planning to pay out of pocket. Hello, my name is Dr. Jonathan Clavell, urologist and penile implant expert surgeon in Houston, Texas. One of the main questions we often receive is how much does the surgery cost? I will try to do my best today to break it down to you. However, the most important thing I want everyone to understand is that the cost varies, and it depends on multiple factors, which include number 1, insurance coverage, number 2, where you have it done, number 3, who you're having it done with, and number 4, when you are having it done. Let's break this down as much as possible. So number 1, do you have medical insurance? In the United States, there are multiple insurance companies, and each of these companies have multiple different specific policies, and some of them may cover the procedure while others will not. Some insurances cover it without requiring a verification process. However, most insurances that do provide coverage will only cover it if the patient meets medical criteria, and the surgeon's office may need to request what they call an authorization or predetermination prior to going forward with your surgery. So what does meeting medical criteria mean? So meeting medical criteria requires specific documentation from your surgeon that explains that this procedure is medically necessary. If there is not a medical cause for the procedure, the insurance will most likely not cover your procedure. For example, some insurances require a man to fail multiple other treatments like pills or injections before they agree to covering your procedure. Others require a specific diagnosis or a cause for the erectile dysfunction, like heart disease, high blood pressure, diabetes, sometimes even radical prostatectomy or radiation therapy for prostate cancer. Therefore, if you have any of these conditions or procedures, the insurance company will take that into consideration and determine that you have met medical criteria, and hence they will cover the surgery. If you are otherwise completely healthy and there is no specific cause like a venous leak or arterial insufficiency, which are causes, the insurance company may decide not to cover the surgery. This is something that your surgeon can help you find out. Within a specific insurance company, there may be different policies. To understand this, let's make up an insurance company and call it Green Dinosaur Health. There may be a Green Dino Health for each state. For example, Green Dino Health of Texas, Green Dino Health of Illinois, Green Dino Health of California, federal, etc. You get the point. And some of these Green Dino Health policies might cover it while others might not. Those that do not cover it have what they call a hard exclusion. What does a hard exclusion mean? Well, this means that no matter what the cause of your erectile dysfunction, be it diabetes, high blood pressure, prostate surgery, and you have failed all other therapies, you name it, it does not matter because that specific policy will not cover your surgery. You may have erectile dysfunction as a consequence, again, of prostate cancer surgery, and the insurance will still not cover your surgery. Therefore, requesting your surgeon's office to send multiple letters to Green Dino Health on your behalf will not necessarily get your surgery approved because your Green Dino Health insurance has an exclusion for erectile dysfunction. Also, asking other people in forums if Green Dino Health in general will cover the surgery will very likely result in an inadequate response for you because Green Dino Health, as with most other insurance companies, has multiple different policies, and you need to find out if your specific policy will cover the procedure. Believe it or not, it can get even more complicated than that, but at least you have a glimpse of what happens and how these things work. Now let's say your insurance company covers the surgery. Great! But the fact that your policy covers the surgery does not mean that you do not have to pay anything. So let's now talk about what your responsibility is. Some insurances cover the surgery at 100%, while others cover it at 80%. Others require a copay, which is a specific amount determined by them that you may need to pay for the procedure. Others require a co-insurance to cover some of it. Most private insurances have a deductible, which is an amount that you should already know when you sign the contract with your insurance. That deductible needs to be paid by you in its entirety before the insurance covers the rest. So if you have a very high deductible plan, you will need to pay that deductible first, and after that is met is when your insurance will start paying for the rest. deductibles can get a bit more complicated, and it's something that you can discuss with your employer or insurance company. If you think this is complicated, there is more to it. When you call your insurance customer service line and speak to a representative, you need to remember that the people you are talking to are not the ones who make decisions for coverage. Sometimes customer service may tell you that you may be covered, but then when your surgeon's office calls to verify your insurance benefits, they tell us that you have an exclusion or that the surgery is not covered. Why is that? When you call Green Dino Health, there is a possibility that the person you are talking to only goes into the computer, puts down the code for the surgery, and that's it. But they may not be looking at that specific policy that your employer provided for you. In addition to that, there are some insurances that cover erectile dysfunction visits and erectile dysfunction related therapies except the specific code for the penile implant surgery. And to make it even more interesting, sometimes they say it may be covered if the patient meets medical criteria, but then add a statement with words like, but this authorization is not a guarantee of payment. And if they end up not covering, the patient ends up being responsible or on the hook for all of that payment. So you might be wondering, so what can I do to know if I will be covered or not? You can always call your insurance company and ask if the procedure you are asking for is covered for your specific policy. If you got your insurance from your work, you can also approach the human resources department of your employer and see if they can provide you with further details regarding your specific policy. But remember, what the insurance representative tells you is not necessarily proof of coverage. We, your surgeons, need to request the authorization, and that will hopefully give you some guarantee that you will be covered. Now, what if my insurance does not cover the implant, or I live outside of the United States and I am planning to pay out of pocket for the surgery? How much will it cost me? The correct answer to that is it depends. And let me try to explain. There are 4 major factors that drive the cost with any surgery. There's surgeon fees, anesthesia fees, facility fees, and materials or supplies. In the case of penile implant surgery, the materials cost is the actual implant device. Let's go into detail on these 4 factors. Let's start with facility fees. That is where you're going to have your surgery done. Is it a hospital or a surgical center? Each hospital and surgery center will have their specific costs, and as expected, some will be more expensive than others. For example, let's say you're going to buy a hamburger. It's not the same thing for you to go to McDonald's, order a burger, and eat it there than going to a steakhouse inside a 5-star hotel and buying a burger there. I'm sure the burger in McDonald's might be significantly cheaper than the hotel burger. Even though you're just eating a burger, many things within that facility may end up driving that cost. Then we have anesthesia fees. Anesthesia fees will also vary. Sometimes though, the anesthesia cost will be included with the facility or hospital fees. Third, we have the surgeon fees, which will also vary depending on your surgeon. And number 4, and finally, we have the cost of the specific implant you want or need. This will also vary. That is, not all implants cost the same. Implant companies have specific contracts with different hospitals and surgery centers, and that will also change the cost of your surgery. Moreover, if you need additional reconstruction for Peyronie's disease during your surgery or want additional procedures like a vasectomy or a sling for incontinence, to give you an example, there will be additional fees for those services. Another very important factor that will drive the total cost of your surgery is when you have it done. As with everything around us, costs increase with time. Inflation also affects medicine and surgical procedures. This is why not even I can give you a specific price in this video, because all these factors will be influencing the overall cost, and depending on when you watch this video and call our office, you might receive a different overall estimate. Disclaimer: if you know someone who had the surgery done and he told you how much his insurance paid for the surgery, try not to assume that what his specific insurance paid for the surgery is what your insurance will pay, or that his total amount will equal to the amount that you would need to pay out of pocket. In general, when we talk about the total cost of the surgery, if you were to pay out of pocket or self-pay, which means that the insurance is not involved, the total cost of the entire surgery is generally less than if your insurance were to be involved. So that's why we as surgeons want to make sure if the insurance will pay, because if they end up not paying, you as a patient will be responsible for a much higher cost. So please trust us that we have your best interest in mind. In summary, as you saw in this video, there are multiple things that affect the overall cost of the penile implant surgery. If the insurance company covers the surgery, this will drive the cost. If paying out of pocket or being a self-pay patient, there will be a surgeon fees, anesthesia fees, facility or hospital fees, and implant fees that will drive the overall cost of your surgery. I understand this may all sound somewhat overwhelming or even frustrating, but this is why you need to be patient with your surgeon and his staff. We are on your side and want to help you. At least I hope that now you have an idea of how this process works and that the answer to your question regarding insurance coverage or total cost is more complicated than a simple yes or no or a specific number or quantity of dollar amount. If you wish for me to be your surgeon, we will do our best to provide you with accurate information. We are here for you. If you have other questions about penile implants, please feel free to comment below and we will do our best to answer them for you. We wish you the best in your journey. Thank you for watching.